As Minister for Public Health, Women's Health and Sport, I'm absolutely delighted to have this opportunity to speak with you today at the Caithness Green Health Seminar. With tomorrow marking the start of Nature Scots Green Health Week, there's no better time to shine a light on the wonderful work that you're all doing to improve the health of the people of Scotland. I'm sure that everyone here recognises the importance of engaging in sport and physical activity outdoors for improving our physical health, our mental health, and our social health. And we know that the use of green spaces has benefits to the immune system and the metabolism, reducing cardiovascular disease and reducing rates of obesity and diabetes. And we'll all have experienced just how wonderful spending time in nature can feel in the last couple of years. It can lift your mood, combat anxiety, and boost the immune system. In the Highlands, we're fortunate to have a diverse natural environment, which are the perfect places to deliver nature-based solutions that help people feel better and improve public health more generally. And it's important that we continue to encourage and support people to use Scotland's great outdoors and the amazing resource it is, to be more active and to spend more time in green spaces. Now, in government, we understand the advantages of green health and green spaces, and we value the work of green health partnerships in encouraging and supporting people to enjoy the benefits which being in nature brings. And that's why we've jointly invested £600,000 in green health partnerships to help improve the links between the health and the environment sectors. And that funding will help enable health and social care professionals to connect people to nature, which can help to address some of the underlying causes of ill health and tackle health inequalities right across Scotland. These spaces can be a catalyst for social connection, helping to reduce social isolation and leading to greater personal and community resilience and well-being. And I have to say, as Minister for Public Health, I hope that one legacy of the pandemic is that we continue to socialise outdoors, get together for a walk, to connect, rather than going to the pub. Personally, I'm a keen supporter for green health and its associated benefits. I'm a huge advocate for the Daily Mile. I've been running it every day for over 4 years now, and I can confidently say that taking those 20 minutes out of every day has allowed me to stay in touch with nature, as well as allowing me to reap huge benefits for both my mental and physical health. I'm not sure I would have got through the last couple of years without my Daily Mile. And I have to say, my dog Cooper absolutely loves being out in the Highlands for a run every day too, although he doesn't mind Edinburgh too much either. Physical activity and sport can have a transformative effect on communities by providing opportunities for people to connect with their neighbourhoods, to come together in shared activities and that inspire and motivate. It's a powerful means of addressing isolation, building community cohesion and developing confidence. Now, I saw this myself just recently on a visit to the Highland Green Health Partnership in the community woodland in Eventon near Dingwall, which is being used for a whole range of activities, from buggy walks, health walks, forest bathing, just using local assets in a way that brings a community together, makes connections between generations, and develops a common sense of belonging. Just wonderful. Eventon Wood also has the honour of being Scotland's first dementia-friendly woodland, helping people living with dementia and their carers to get outdoors through a variety of different activities. And it's vital we make opportunities to participate in green space activities as inclusive and as accessible as possible for everyone. And I'm sure that Kirsty Ewen from Scottish Disability Sport will tell us more about that today. Now, unfortunately, I'm not able to stay for the whole seminar, but I'm going to try and stay on until 11. My officials from Active Scotland are here today, so they'll be able to report back to me on any thoughts and ideas which you have on how we might further develop our approach. And I hope you have a fantastic day and enjoy the event. Thank you.
Now, the next presenter on the agenda, or the first presenter on the agenda, is myself. So I'm just going to get a wee presentation up now and tell you a little bit about what we've been working towards as the Highland Green Health Partnership, and more specifically about what we're aiming to achieve in the Caithness area and what we've started as well. Yeah, so the Highland Green Health Partnership was established back in 2018. We're one of 4 pilot partnerships in Scotland, the other 3 being in Dundee, Lanarkshire and North Ayrshire. And our main aim is to try and connect people to nature for their improved physical and mental health and well-being. On the partnership in Highland, we have about 16 partners. It includes NHS, the Highland Council, High Life Highland, Pass for All, the University, Forestry Land Scotland, Nature Scot, as well as a number of representatives from health and social care in the third sector. And really, we've been working for 3.5 years now, and the first slide is really why do we do what we're doing? As Maree said in our opening presentation, there's so many benefits for connecting with nature, but not everyone's realising those benefits. So in the Scottish Household Survey of 2015, it showed that less than 50% of adults in Scotland were visiting the outdoors on a regular weekly basis, and at that time 14% didn't visit at all. Now, the picture's changed somewhat since the COVID pandemic, and what we're seeing is more polarised behaviours. So for those who had to shield or stay at home during the lockdowns, it's actually becoming harder for them to re-engage with the outdoors. People have lost confidence, people have lost their strength and conditioning. And on the other side of the spectrum, for those that were working from home and told to exercise locally regularly, they've maybe had the opportunity to engage with nature on their doorstep and discover some of the green spaces close to home. So we need to sort of balance working at breaking down the barriers for those that are struggling, and also maximising on the opportunities of those that are now starting to realise the benefits. At our Natural Health Service, the work of the Green Health Partnerships are sort of undermined by this framework. We cover public health and social care, and we do 3 main pillars of work, which are the green boxes in the middle. The first is everyday contact with nature, which is a very broad brush approach, targeting the whole population with messages about the benefits of getting outdoors and promoting the opportunities. The second is nature-based health promoting initiatives, and this is supporting some of our services and activities such as the health walks, the green gyms, community volunteering programmes and gardening groups and such like. So in Highland, over the last 3 years, we've been running small grant programmes, and we've managed to fund 53 initiatives directly through Think Health, Think Nature. And we've also been working to support a number of groups with external applications to things like the Community Mental Health Fund, the Ideas Fund, Big Lottery and Heritage Horizon. And the main aim of that work is to close any gaps to make sure that the services on offer are meeting the needs of the local population and meeting the audiences that really need the benefits the most. So I'm not going to dwell too much on those, but what I really wanted to talk about today was about this third pillar, which is the nature-based interventions with a defined health or social outcome. And this is what we describe really as green prescriptions. How might we get primary care to refer people into nature-based activities as a treatment or recovery intervention? So we've created a website, and on our website we have a directory of all the activities that we've mapped so far in Highland. This directory at thinkhealththinknature.scot is divided into the different areas of Highland. You can click on the area that you're living in, and you can find a variety of activities under the 8 categories of green health, which are walking, cycling, gardening and growing, outdoor learning, volunteering, outdoor sports, creative arts and relaxation and mindfulness. So it's very much hoped that this is a tool that people will self-lead themselves to, but also can be used as a discussion tool for health practitioners in encouraging people to take up new activities locally. We also have a lot of information on availability of active travel paths, cycleways, green spaces, and a lot of resources in a resource library there that can help people engage themselves without actually having to connect with a group or activity. So we've developed a natural pathway to recovery and health. And the idea of this pathway is that no matter where you are in your health journey, there'll be some way for you to engage with nature, whether that's bringing nature indoors if you're homebound or ward bound, or making everyday contact with nature if you're a bit more fit and able. There's something on that spectrum for everyone, and we've created a resource library of things for you to do wherever you are on that spectrum. And of course, any one of us could suffer from ill health or injury, and the idea is that if you take a slip back, you don't need to give up doing the things you love. There'll be other ways for you to engage. And also for those that may have degenerative conditions such as Alzheimer's, there will come a point where you can no longer re-engage with certain activities, but that doesn't mean that you can't get outdoors and enjoy nature in other ways. So all our resources on our website there are together with a section about some of the evidence around the benefits. And that really helps us when we are that builds a foundation for looking towards working at green health nature-based interventions or green prescriptions. Very early on in Highland, we realised that there couldn't really be a central Highland-wide approach to this because the different geographical areas in Highland have such a huge variance in the type and availability of green health activities that people can do, the availability of volunteers, of third sector support agencies, even health staff. It's very different as you go into the different communities, as is the sort of culture and behaviours of the different communities. So we decided to run this as pilots, and the first 2 pilots took place in Aviemore, which is an area that has an awful lot of green health opportunity, and Kyle, which was an area that didn't have so much green health opportunity. And now we're moving into Caithness, which is why we're here today, Easter Ross and Loch Aber. So in the pilots, we're trying to establish what services and resources are available. Do the services meet the health needs of the patients? Are the service providers equipped to take referrals? Are health practitioners confident to refer to these organisations? What's the preferred mechanism of a referral? And the role of the support agencies and the link workers. And very importantly at the bottom, how do we monitor impact and feedback? So looking at the mechanisms for referral, what we've learned today is that there's 3 broad types of green prescription mechanism. The first type is a direct referral, and this is a very formal referral that requires a lot of quality assurance, GDPR and safety around it. There's lots of processes around it. And in this referral, a health practitioner might directly pass a patient on to a specific service that's aimed at that patient's need. So an example of that might be the Branching Out programme that is developed through Forestry Land Scotland, and we run a few of these across Highland, and I believe that some of our Branching Out programme leaders are here today. So a direct referral will have a very high impact because it's very much aimed at those that need it the most, but it'll have quite a low reach because it's quite an intensive process and quite specific. A supported self-referral is where a patient has a person-centred conversation with a professional support worker or likewise, who can discuss their options with them, find out their needs and their wants, and direct them and support them to reach a service in the area. It still requires the person to sign themselves up to the service, but it might include the addition of community transport or a befriender to help buddy them along to that service. So a supported self-referral has a fairly high impact and reaches more people. Finally, probably the easiest referral pathway is self-referral. So this is signposting, providing people with information and about what's out there and encouraging them to take part. This can reach the largest number of people, but requires on those individuals to be motivated to want to make those changes. So in looking at our pilot areas, the focus tends to be moving much more towards the supported self-referral model at the moment. And we're very fortunate now that in Caithness we have link workers associated with GP practices, and we also are working with the Active Health Project, who can give that kind of person-centred support to individuals to try and maximise the number of people that we engage with green health. We're also looking in Caithness at the barriers to people getting out there, and the barriers can be summarised into behavioural barriers, physical barriers, administrative barriers, not just for the participants, but also for the organisations receiving the participants. If things become too bureaucratic and paper-based, it can be very off-putting at both ends. And the financial barriers, it's a reality that the vast majority of the activities that are placed in communities are run by the third sector, and there is the continuity of funding issue there, and the volunteer turnover, and also just the nature of Highland, the access to transport and how you get there, and clothing and equipment, and the weather and the midges up here. Yeah, clothing and equipment comes at cost too. So briefly, some of what we've learned in our pilots to date were that self-led activities are often a first step to nature engagement, that referrals into organised activities don't have to come from the GP, but can come from other health and social care professionals. Up-to-date information on what's available locally is essential, and Green Health Champions can help. I cover all of Highland, and it's absolutely invaluable to me that we have steering groups in the localities where people have a lot more local knowledge than I could ever gain. And so we're very grateful to the small steering group that's working in Caithness. Service continuity is vulnerable in rural areas due to the low volunteer turnover and the short-term funding. Communities welcome support and capacity to make some successful funding applications, and the offer of skills and training for volunteers increases confidence to receive referrals into those activities. So we're now looking at building capacity. So this is a lovely picture of our first workshop, which took place last week in Thurso Library, where a number of those people providing activities across the community came together to discuss how we might take green prescriptions forward. So what we're doing in Caithness now is we're gathering lots of information about the availability and the types of activities. We're creating networks for shared learning, and promotion and progression pathways. We're going to be providing training, that could be first aid training, mental health training, Alzheimer's awareness, cancer-friendly training as well. So we've done a bit of a training needs assessment locally, and we'll come in and provide the training that the service providers say they want. And we're going to have a come and try event on the 25th of June that's going to take place in Thurso, and we'll be inviting the health practitioners down to meet some of the service providers and some of their participants to see what it's all about, and really be reassured and motivated to want to refer people along to them. And finally, we've got some green health packs that we've developed for people's self-led activities, and I've passed these on to the local link workers in the area so that they can pass them to some of the patients they're engaged with. And that includes some local maps, nature IDs, smart apps, and a walking journal to try and encourage people to do self-led activities as well. So that's just a brief, very brief overview of what we're doing in Caithness. And now I really look forward to passing you over to Sara Bradley, who's going to tell you a little bit more about the social prescribing aspects of this work. I am in the process of developing some community green health guidance and a toolkit to enable other communities to follow the processes we're doing at the moment. So my pledge today will be to finish this guidance and get that published so that others can make use of it. Now Sara is going to use my computer, so you're going to see my very messy desktop, folks. Sorry. First slide. There we go. And apologies, I need to put myself on mute. My dog is growling in the background. Hold on. Right, Sara, I'll hand over to you and I'll get it on the first slide.
Okay, thanks. Okay, I think I'm gonna switch my camera off because this is running really slowly for me. So apologies for that. Okay, Sara Bradley. I'm a research fellow with the Division of Rural Health and Wellbeing. at UHI. I'm just going to talk about the value of social prescribing based on some of the projects that I've worked on. Next slide, please. Okay, so when I go out to communities and do interviews for research projects, people sometimes ask me if I do medical research or if I'm a medical doctor, and I have to disappoint them and say, no, I just do social research. But the reason this type of social research has a role to play is because health is not experienced in isolation from all the wider social and economic issues affecting people's everyday lives. So when I ask people about their health, I get to hear about their families, their work, communities, and the many other factors affecting physical and mental health. So as a researcher, I'm interested in these social determinants of health and the inequalities that often arise from them and what this means for future healthcare provision. So social isolation, stress, poverty all take an enormous toll on health, and we've all seen this during the pandemic. And that's why social prescribing can make such a real difference. It's about taking a holistic approach, taking in all these factors that affect health, factors that are, often out of the reach of conventional medications and treatments. And social prescribing can involve a range of many different things, connecting people, getting them outside, using green spaces, getting people physically active, joining walking or cycling groups, gardening, nature activities, and also peer support. So I'm going to give two examples of research projects that I've led, the Active Health Link Worker Evaluation and also the Bespoke project. And both these projects are run by Velocity, which many of you may well know is a social enterprise in Inverness promoting cycling to increase mental well-being and encourage healthier lifestyles. Right, okay, so busy, I'm sure, as you all know, busy health professionals don't generally have enough time to signpost community services or, outdoor activities. So this is where the active health link workers come in, and they help patients to identify opportunities for exercise and using green space and being outside in their local areas. But it's much more than just signposting. They build relationships with the patients and help them address personal barriers and make these lifestyle changes. And as a researcher, I know very well the evidence on the benefits of being physically active and being outside, and the strong links between physical activity, being outdoors, and mental health. But when it comes to persuading people about changing their lifestyles, I think we need to put ourselves in the position of someone who's not used to thinking like this, someone who thinks the idea of joining a walking group or going to the gym or whatever is very intimidating, particularly if they've tried to make changes in the past and haven't been successful. And this may have reinforced a sense of personal failure. And they've probably had generic advice on healthy living from health professionals, but the idea of trying to change your lifestyle can seem very daunting and out of reach. And just because someone lives in a rural area with lots of green space around them, it doesn't necessarily mean that these spaces are easily accessible and that making these changes is easy. So making change and trying to integrate this with the realities of daily life can be hard, particularly if you're already experiencing disadvantages. So the active health link workers support people to make these lifestyle changes and turn around this idea that exercise and being outside and being in green space isn't for them. So the key is agreeing realistic targets at a level where people feel encouraged rather than pushed. And in the interviews, people gave lots of positive feedback about the project. They liked the relaxed and informal atmosphere, and they liked the fact the link workers are non-judgmental and very supportive. So when one interviewee describes this and says, she spoke to me like I was a normal human being. She made me feel like relaxed and at ease, like just speaking to a friend, and there was nothing like looking down at me. Okay, next slide, please. So the second Velocity project is the Bespoke project, and this was about developing an intervention that could be socially prescribed. So they led cycling groups around Inverness, and the surrounding area to promote mental well-being, and they targeted this at people from different disadvantaged groups. So they work with various organisations like community residential units for people with enduring mental health conditions, Women's Aid, the Calman Trust for Young People, One Stop Shop for Adults with Autism, and also the Teenage Cancer Trust. And the idea was to take cycling out to people via these organisations they're already involved with and that they trust, rather than having to rely on people coming to them. So the interviews with participants showed the impact was very positive. Some found their physical health had improved, and the sessions had given them a route to keep on cycling, either for leisure or to increase their independence. Just getting them a new way to get around. But in fact, the greatest impact was seen in mental well-being, increased self-confidence, self-esteem and motivation, and participants felt more relaxed, less anxious and less stressed. And the project, allowed them to set and meet goals and gain a sense of achievement. And this was crucial to building confidence. And this sense of a shared experience in the group and this non-judgmental atmosphere really helped them to build up this confidence and connect with each other. So the key factors for success is summarised here. For example, the highly skilled and experienced cycle leaders were able to motivate participants and make the sessions fun. And no one had to worry about the right clothing or equipment, or not having the right equipment, the clothes for the weather. Velocity provided everything for free. So, and this bespoke approach was really important. So sessions were tailored to the specific needs of these groups and individual abilities. Next slide, please. So I think one of the best ways to show the impact is to give these quotations from some of the participants. For example, one of them said, I was apprehensive because I thought I would have panic and stuff, but no, it was all gone, and I felt this sense of achievement that was new and strong. And now I use my bike to go around the block every day. And another said, it's given me a strategy for well-being, something really tangible that can instantly lift my moods. I get really emotional when I talk about cycling. I love it. So this impact described here on well-being came from the combination of three things: the social element of being in the group, being outdoors and having the contact with nature, and also the choice of the activity, the actual cycling. And being outdoors was very important for people, and interviewees linked to exercising out in the fresh air with a sense of well-being and very importantly, freedom. Next slide, please. So both these projects, as I've said, have had very positive results, but they've also faced challenges which are common to other social prescribing interventions. Sourcing funding for these services remains a really big issue, threatening their sustainability. Both these projects were funded on a yearly basis. A lot of staff time is taken up with applying for funds. The bespoke project in particular struggled to find funding for a second year and was put on hold despite its success and the fact that it had a waiting list of organisations ready to sign up for more sessions. Services are not always available in communities, particularly in rural areas. Accessing services can be difficult, especially if you need public transport. Link workers, as Ailsa said, you've got link workers here and they're being introduced across the Highlands, but without link workers, referral is dependent on health professionals having time and knowledge to recommend community groups and outdoor activities. Next slide, please. So I've just started a new project called Prescribe Heritage Highland, and this is funded by the Arts and Humanities Research Council. And what we're trying to do is to look more closely at some of these challenges. We aim to look at how to scale up social prescribing interventions and how to integrate them into mainstream healthcare. And we'll be trying to look at factors that make social prescribing more sustainable in a rural context. And we're working with Ruth Ann Baxter from Edinburgh University, who's developed a very successful prescribed culture programme. And we're working with High Life Highland and the Museums Heritage Highland. And they're going to deliver a programme of nature-based and cultural activities to people referred by GPs and other professionals. So and we've also got a stakeholder advisory group with representatives from NHS Highland, Highland Council and the third sector, and they will be really important in contributing to the project. If anyone wants to know any more about any of these projects, then please do get in touch. And just the last slide, please. So I'll just finish with the words of one of the participants, again from the Bespoke Cycling Project. And I think these words are people's words are really more powerful when you remember the kind of situations that they've been struggling with on a daily basis, whether that's enduring mental health conditions, domestic violence, low levels of self-esteem, often feeling very isolated and powerless. So this participant said, it's definitely helped my mental well-being. After the cycling sessions, I just felt really, really happy. It just felt so good to almost feel normal, and feel happy. That made a big difference. There's some weeks I've just wanted to collapse because of some of the stuff I've been through. So when she says that made a big difference and she felt more normal and happy, again, we have to remember that for her, life had not been normal or happy for a long time. And the cycling group gave her something really positive to build her life back up again after a very, very tough time. So experiences like these show that social prescribing has real power to change lives. Great. Thanks for listening.
Thank you very much, Sara. That was absolutely fascinating. Now, I realise I omitted my formal introduction to you before that. So Dr. Sara Bradley is a research fellow in rural health and wellbeing at the University of Highlands and Islands, and she's worked at UHI since 2009 and has an extensive experience of carrying out qualitative and evaluative work in rural areas, as has been demonstrated there. So thank you very much for that. I'm now going to invite Rory Milne to come and share his screen and give his presentation. Rory is co-founder of Nature for Health and has worked in the outdoors for over 20 years. With an educational background in zoology and a master's in wildlife and conservation biology, he knows his way around the woods, and we've all had practical experience of that, including Maree very recently. So Rory's going to tell us a little bit more about the actual practical side of delivering a nature-based activity to those that are referred into it. So over to you, Rory.
Hopefully this is working. Good morning, everyone. Thank you for having me along. Is that working okay, Ailsa?
Yeah, perfect.
So yes, Stephen and I set up Nature for Health a few years ago when the charity we were working for folded, and we saw that there was still a need for the work that we were doing, and the funders agreed, so we set up this vehicle. It's still predominantly just me and him, but we have a small team of select freelancers who work with us doing different bits and bobs. So I was asked a few things, and we'll can talk about what some people ask about. What is green health? And I think if we think in terms of, we all have physical health, but we all have mental health as well. And physical health might be up and down. You might have a cold one day, you might be feeling fit as a fiddle another day, and it's the same with mental health. These things are very much tied together. Huge amounts of research has shown the link between mental and physical well-being, and nature is simply the best vehicle place, by and large, to support this holistic approach to health and well-being. One could equally say brown health if one lives in a savanna area, or blue health if we're talking about by the sea or by a river. But we live in a verdant and damp green country, so green health is the term that we're using, which is great. There have been a lot of research shown about the benefits of health for well-being. One of the classic early ones was two groups had the same minor operation in the hospital. One half of them were put into rooms with a window looking out over a brick wall, and the other half of the group of the study was put in a room with a window looking out over a green space. And there was a statistically significant decrease in recovery time in the ones looking out over a green space. We evolved in a natural environment. We evolved over millions of years to be in nature, to be around plants and long views and the natural environment. We didn't evolve in a world of hard, flat edges, sharp corners and artificial light. So we will feel naturally more comfortable at a very base level and do better in a wild and natural environment. And yes, there's lots of research into this, and I'm just going to skim through a few of these slides and details about it. A lot of it was covered by Maree at the start there, and a lot of this was covered as well in Sara's work and in what Ailsa was saying. So I'm just going to quickly skim through these, and you can have a read if you fancy. Basically, long and short of it, nature is good for you, and the research backs it up. What we hold perhaps new intuitively. So Nature for Health, we run a few different programs. Well, we run a whole bunch of different programs, but our sort of core programs, I'm just going to talk about 5 of them here. Was mentioned earlier, branching out, developed by what was the Forestry Commission and the NHS many years ago, and different people deliver it around Scotland. We currently have 3 programs running in Forres, Elgin and Nairn. And this is a wonderful program for people who are using mental health services. They come out with us once a week for 12 weeks, and we'll cover various trainings such as the John Muir Award. This program, we're going to be doing a first aid course out in nature, and there's a few of the participants are taking up the Adult Achievement Award. But we'll do a whole range of different activities, but with a core focus on sitting around having a cup of tea and a biscuit and relaxing in nature, being warm and cozy, and just enjoying being where we can be. This scene here is by just above Sanker Loch, and being by water and in the woods is even better. Some of the activities we might do include carving green wood, cutting a few little mini mushrooms here, burning bowls, using coal to burn a bowl out in a piece of wood, making cordage. This is from nettle fibres. So I'm just judging these. Oh, actually, we could have done this a bit tighter, but no. Just general gentle activities. We tailor them to suit the group. Some groups we can't do knife work with because of lack of motor control or other tics and things. Some groups really get into the carving, so it might be a more artsy course, might not be. We also run various activities with primary school people. One of our key programs there is Resilience in Nature, which is a once a week for 5 weeks program addressing mental health, just talking about mental health. It's a very forest school style program. We're all forest school leaders, talking about mental health, raising awareness and getting people to start talking about it. It's easy to start talking about it when we're young, so that it's more comfortable, and being aware of it when we're older, when it becomes get awareness and coping strategies in before they're needed, so that when they're needed, we're there to go. This was actually in Wreckage Nature Reserve, so the awesome Caroline Snow at the background there, who some of you may know, and my colleague Stephen at the front. And very good sunflower. Might do arts activities as part of this, such as creating a mandala here, and that itself can be a very useful teaching tool, as well as being a beautiful and creative thing to create. And as part of, again, the John Muir Award, we'll often do the Discover level with the primary pupils, and might do, this is making bird feeders from an orange, cut it in half, eat out the inside. You might do a mindful tasting activity with eating the orange, tasting the juice, and then fill it with bird seed and suet, and then some biodegradable string, hang it up, you've got a bird feeder. And also perhaps some arts and crafts there. This dancing fairy creature was found on one of our programs. Another thing we do is our Green Health Days. Did our first ones thanks to Think Health, Think Nature. Thank you, Ailsa. And we're now currently in the middle of a program. We're delivering 1 a month for 6 months throughout the Highlands for refugee families, including a few families up in Caithness. We're hoping to bring some of them down to a program in a few weeks' time at one of our Green Health Days. These days we have a range of activities throughout the day, and people can come to the whole day or drop in and out and do the activities they like. And again, there's always a focus on having a fire, having food on the fire, cups of tea, there's a kelly kettle there, and a tarp, because if it's wet, we need to keep people dry and cozy. But more about that later. We might do tracking activities, tracks and signs. How many of those skulls there can you identify? The one on the right is a recent reintroduction. Well, maybe, yeah, talk about this another time. Yes, tracks and signs. We might divide the activities so that there's groups for the younger people, and then going off and playing with one of our leaders, and another leader might be leading activity with adults, so they'll be close but separate, or we might be running activities together. And each Green Health Day will be slightly different. So these 6 we're delivering, excuse me, for the refugee families, will each have a different theme and a different taste. There'll be some of the core things: fire, campfire cookery, teas and coffees, but there'll be different stuff such as foraging, different crafts, willow weaving and so on. Another of our activities, core activities, is our nature walks. This was started up by Stephen almost 10 years ago with Scottish Waterways Trust, and we took on with Nature for Health. We run these in Inverness every Thursday, alternating Forest and Elgin every Wednesday, and every Friday alternating between Nairn and Aberlour. These are, anyone is welcome, everyone is welcome, but we have a particular openness to people with mental health issues. So our Inverness groups, we have a lot of people coming from Anachmore, Birchwood, Highland, people in sheltered accommodation. People might come with their social workers or their support workers or occupational therapists, and then but then after they've gone through that system and back living independently, they might still come back and have that ongoing connection with familiar faces, familiar with occupational therapists from before. And it's that sort of ongoing continued support. So we commit to delivering these 52 weeks a year. And people can always come along to our walks and see us. And I'll talk more about those in a bit. Some of these walks, we get quite high numbers. This is a beautiful spot out by Doc Garrick, and it's one of my favourite spots, beautiful oak trees there. We also run using nature as a resource to support mental health trainings now, which is training for trainers. We delivered this through Ailsa as well and through others around Scotland. It involves an online segment where we do it's about 3-hour online training, and then we have an in-person full day session. Moving on. Yeah, what are the challenges to getting people out and experiencing the benefits of green health? An obvious one might be the weather, but we find that's not a problem so much. This lovely muddy spot here, just need to have wellies. There's a very happy dog in the background who you might be able to spot, who does not need wellies. If it's snowy and cold, we always have spare hats, spare gloves, spare waterproofs, spare kits. So even if people turn up fully unprepared, we make sure that we can get people kitted up and out in nature. And if it's a really soggy day, we might put up tarps as well as putting out waterproofs to make sure that people are warm and dry and happy. What we actually find is as a barrier is more getting people out in nature. A lot of the research has shown one of the best treatments for low-level depression, low to mid-level depression, is not drugs so much, and even as good as or better than talking therapy is simply physical exercise. But if we're feeling depressed, physical exercise, getting out in nature is one of the hardest things to do. So I might know that it's the best thing for me when I'm feeling down, but I want to just sit and watch TV and be a vegetable. It's a tricky one. This is the problem, is getting people out there. An example being one young lad I work with, well, I was working with once a week on a 2-to-1 ratio. Every week he's in sheltered accommodation. Not this young lady here, that's Stephen's daughter. He would usually have a tantrum before coming out. He's about 13, and the teacher had a big struggle getting him out to the woods. When you got to the woods, he would be in a grump for the first 5 minutes and half maybe run off ahead, lots of swearing and shouting. But after the first 5-10 minutes, he had the best time, and he would be fully engaged, laughing, jumping around, having fun. And the teachers back at school report that he would be much more calm, much more at peace, much easier to work with, much happier for the rest of the day after having been out in the woods. Huge benefits. Just the challenge of getting through the noise and stumping to get him out there. So yeah, it's getting people out, and often we'll have people booked on for one of our Green Health days, and booked on that. We have people booking for sessions sometimes, and it's especially through COVID we were doing that, and so we have 20 spaces, 20 people booked on, fully booked, turning people away, but it's free because it's a funded opportunity. Only 10 people turn up, and that can be a challenge, but we find our way through. So we've seen from our programs that they're hugely beneficial, and we get that feedback, and luckily we have Sara joining in with our Green Health Days to do some assessment. So we're very grateful for that, to get some not assessment, evaluation, to record some of the benefits, because the benefits are big. With our nature walks, there was some research done, I think also by Sara, and we found that people not just reporting the benefits for themselves, but the OTs were reporting benefits for them as accompanying their clients as well. And it's not just the hour-and-a-half nature walk, it's the benefits over, spreads out over days. So the day before, there's the build-up, looking forward to it, planning for it, talking about the day, on the day, getting ready and doing the walk, having a cup of elderflower tea. And then the day after, well, for the rest of that day, people might be more relaxed, more calm and peaceful and rested, and of the days after you can then talk about what they saw. They saw a baby adder, they maybe went out and saw amazing views. Just an hour and a half, the benefits from that can be, session in nature can be spread out over several days potentially, and have much longer term benefits, and even inspiring people to get out in nature and find those benefits for themselves. And I think I've just managed to get that just below 15 minutes, so I'm quite pleased with that. Thank you very much.
Thank you so much, Rory. Now, our final speaker today is Kirsty Ewen. Kirsty is the Regional Manager for Scottish Disability Sport, responsible for supporting partners to be inclusive, opportunities for people with disabilities to engage, participate and progress in sport. She also works for SAMH, the Scottish Association for Mental Health in Sport and Physical Activity. But mostly, Kirsty is a very big champion of engaging with nature for mental health benefits, and is here to give us some personal reflections. Thank you, Kirsty.
Thanks, Ailsa. Yeah, I'm mostly going to focus on my own kind of journey and my personal experience, but we'll touch on the jobs that I do as well, and the importance that we place on kind of getting outdoors for people's mental health and well-being. So I've struggled with my mental health since I was around the age of 11 or 12, and obviously at that time I didn't really understand what was going on or know what was happening, but I started to self-harm as a way of kind of coping with those feelings and what I was experiencing. At the same time as that, I was a swimmer. And all I ever wanted to be when I grew up was a swimmer. I wanted to swim at the Olympics and had no other career plans whatsoever. But kind of by the time I was 14, 15, my mental health had deteriorated a lot. I didn't want to tell anyone what was going on, and I was self-harming kind of daily. So I made the decision to quit swimming. And as you can imagine, because that's all I'd ever wanted to do, it didn't really have a positive impact on my mental health. But luckily, around the same time, I got introduced to sports leadership and volunteering through the Active Schools programme. And just fell in love with helping others and being part of their kind of active journey, whether that was kind of with little kids or with older people within the community. I just loved being kind of out and about and experiencing different things. And for me, it really gave me something positive to focus on when the rest of my life was really not going well. Since kind of being a teenager, over my life, I've had multiple suicide attempts, and throughout my life have genuinely thought that the world would be a better place without me. I couldn't see that I added value, and I couldn't understand kind of what the point was for me to be alive. But volunteering started to kind of change my mindset around that, and I could see that actually I had a purpose and there were things that I was doing that were having a positive impact for other people. So kind of did lots of different volunteering, got the opportunity to volunteer at lots of different events. And then in 2014, a position came up within the Open Water Committee in Scotland for an event coordinator. So I thought it sounded like fun. Bear in mind, I'd never been open water swimming. I'd always wanted to try it when I was a swimmer, but at that time my coach wouldn't let me. So had no knowledge of open water whatsoever, but I thought it sounded really fun. So I applied and I got the position and started with them that summer, and I've organised the Scottish Open Water Championships every year since then. And for me, it just opened up this new door. So I'd never thought about outdoor sport or how being out in nature could have a positive impact for me. But as I started to kind of get to know the people within the open water kind of setting, whether that was swimmers, parents, other volunteers and coaches, I really quickly realised that it was like a family, and everyone looked out for each other. Although the kids were competing, there was no kind of horrible competitiveness. Like, everyone just really encouraged everyone else and wanted to see them achieve as well as themselves. So I found this whole new community that I could be part of, and that was really special for me. Also, the feeling I got from being outside volunteering was huge, much more positive than kind of some of the other volunteering I'd done, although I did love it, and it had a really positive impact on my mental health. Spending a day outside on lochside across different lochs in Scotland really helped to make me feel a lot better by the time we finished days. And over time, I noticed that that had a real impact on my overall kind of well-being and on my mental health as well. And it really became key in kind of managing my own mental health. So those events were really important. After a couple of years of volunteering within open water, I decided to get back into coaching. I wanted to be involved in the sport more, which is something that I never thought would happen. It took me a long time to accept the decision that I'd made to quit, and actually to forgive myself for that. But getting back into coaching was amazing. I got to help lots of kids develop, and I still coach now. It's back to taking over my life, so I coach 5 times a week in Inverness, and absolutely love it. I love being able to help other people, and I really just try and be that positive kind of influence that I really needed when I was younger. I always make sure that the kids know that regardless of how they perform, I'm always proud of them, and actually the most important thing to me as a coach is that they're happy. So I had the opportunity to take them out for some open water sessions, and it really helped us to keep some of the older kids engaged who were thinking about leaving the sport. Going out into the open water, they felt just free, and it was a really positive experience for them, away from the kind of pressure cooking environment that they were in within the kind of pool environment. So being able to introduce them to those experiences was really important, and again had a massive impact for me in terms of how I felt. As I said, when I was a swimmer, I really wanted to try open water, and I never actually had the chance. So after kind of taking the kids out in open water, that kind of happened for a couple of years, and I was always like, right, next year I'm going to get in, next year I'm going to give it a go. And next year kind of never came. It took me a lot of time of helping them in sessions, of being at the open water events, of talking to other people. I even would go to some kind of informal sessions that parents and swimmers were going out in lochs by themselves, and I would go and stand on the bank and watch them. But I just never could quite get the confidence to actually go in myself. I knew there were groups that met locally, but for me, I always got too anxious and just couldn't actually get myself to go and be part of that group and try open water. And then in 2018, one of my swimmers' parents phoned me and said, we're going swimming, do you want to come? And I was like, oh, no, I'll just leave it. And they were like, well, we're coming to your house just now to pick you up, so get your stuff ready and come with us. And honestly, it's one of the best things that anybody has ever done for me. As soon as I got in the water and started swimming, I just felt this complete sense of relaxation. Over the years, I've tried to get back in the pool, and it's always been a really negative experience for me, but I absolutely loved my time out with them. I didn't swim as far as them, didn't swim as fast as them, but actually none of that mattered. All those things that I'd had in my head, that I'm not fit, I'm going to be really slow, I'm going to hold everyone up, all just kind of dissipated when we got in, and it was such an amazing experience. So since then, I regularly go out and swim in different locks across Highland. Absolutely love it. And for me, I've never been good at actually putting myself first and actually thinking, what do I need to help keep myself well? I've always just really packed my diary and done loads of volunteering on top of work to make sure that I didn't really have time to think about anything. And the biggest difference for me when I'm out in the middle of the loch is that my brain just stops. So I'm not worrying about what's going to happen. I'm not analysing something that's just taken place. I'm not worrying about my mood. I'm just completely in that moment, looking around at stunning scenery and just feeling really calm and relaxed. So that's been a huge benefit for me. But I would never have done it if they hadn't come and physically got me and taken me there, because my anxiety always stopped me. So I'm really grateful that they came and did that. So part of the positive impact it's had on me has been finding that new community. It's been that improvement in my mood that I can see whether I'm out swimming or I'm out volunteering. It's actually being out in the fresh air and not just locking myself in the house and trying to hide myself away when things aren't going good. And it's also given me an opportunity to travel. So I got to take some of the team away to Cyprus and coach them over there, which was really fun. And apparently it's a much nicer experience taking part in open water when you're in a warm sea compared to a 13-degree loch in Scotland. On top of that, I obviously work, as Ailsa said, for SAMH and for Scottish Disability Sport. Within SAMH, I'm involved in the training team, and we work across sport and physical activity to try and break down the stigma around mental health and to promote conversations, to equip people to be better skilled to have those conversations when people are coming into their clubs and sessions, and just create that bigger kind of empathy and more understanding. And then within Scottish Disability Sport, we hear all the time about how being out in nature helps our participants, helps improve their mood, helps sometimes improve their conditions that they experience, and that's really positive. And we hold a summer camp every year that's back this year after COVID, and it's being held in Highland in the summer, and it's a 2-day, 3-night residential for young people between 10 and 17 who have a physical impairment, visual impairment, or a hearing impairment. And the results that we see from the start of that residential to the end of the residential in people's confidence, in people's self-esteem, in people's self-belief are really huge. So it's a really important part of the work that we do. But yeah, in my experience, the biggest thing has been those relationships with people, those positive role models who've helped me, having that group support and actually just coming and picking me up rather than leaving me to eventually join them, which never happened, and just making sure that I'm actually putting myself first sometimes rather than always giving to other people, because I've learned that that's something I have to do to help me manage my mental illnesses. Thank you.
Thank you very much, Kirsty. If you would just like to keep your camera on, and can I invite also Rory and Sara to pop your cameras on now too. And we're open for questions. So if you'd like to ask any questions to our presenters, please just raise your hand. If it's directed at anyone particular, please just say who it is directed at. Everyone's just overwhelmed and gobsmacked by that all. Here we go, George.
Hi. Question for Sara. Sorry, in relation to the Kirsty, in relation to the swimming. Do you find that there's availability of maps and whatnot to help you to try and choose your locations that you go swimming, or do you just go by local knowledge?
Yeah, a lot of the time it's local knowledge. If I hear somebody's been to a place, I'll go there. But I am quite a creature of habit. So now that I've found a couple of locks that I like, I've started to kind of stick into them. But yeah, I guess it'd be really good to find out where more locations are to try them.
Okay, I've got a link to the North Pilgrims Way, which has got a significant number of bits that have been written about wild swimming in particular. So I'll put it in the chat and you can have a look at it, see what you think.
That'd be great. Thank you.
Thank you, George. Any other questions? I have one, if I may. I think it's for, well, it's kind of for all of you, really. So, you know, Kirsty, you mentioned that if it wasn't for these individuals in your community really persuading you to get out there, you wouldn't have got out. And Rory, you mentioned it's getting people out there that's the hardest thing to achieve. So I guess, Kirsty, if there'd been professionals, this is my question really, Kirsty, would they have helped you, or did it need to be someone you know? That's my first question. And the second one to Rory was, do you work with any current professionals that help you overcome those barriers? And maybe Sarah's got something to come in there as well. So start with you, Kirsty.
Yeah, I think for me, I was involved with professionals. I've been involved with professionals since I was about 15, and nobody had ever kind of suggested like getting outdoors or go trying outdoor swimming or anything. So I think for me, if they had, it might have made a difference, but it was really that like holding hand approach that we're going to come get you and we're going to go that really made a difference. So I think regardless whether it's a professional or somebody that you know, the important part is taking the time to build that relationship. And also I think obviously I said, you know, I went and watched a few times and went and kind of just saw how things worked and what happened. So I think it's really important that it's just at everyone's kind of individual pace. Especially going into group settings and things. Like I was listening to Ruaraidh and I was thinking how great all of that sounded, but actually would I have the confidence to go along? Probably not. And that's me now, kind of a lot down the line. So yeah, I think the time to build those relationships is probably the most important thing, whether it's a professional or people within the community.
Thank you. And Ruaraidh, do you want to come in?
That it can be intimidating, these programs. So one or two of the people on our branching out program at the moment are come along with a carer, one-on-one carer, to support them, and they in turn are getting a lot from it as well, I hope. We have Birchwood, Highland and Annachmore in Inverness. They come most weeks out on nature walks in Inverness, and they have their staff that support their clients. And that's part of the idea of these nature walks and all the multiple programs. They sort of fit together in a pathway, and that people can maybe come out in a supported capacity to our nature walk for an hour and a half, see how that goes, and after getting comfortable with that, they can maybe then commit to something longer, like a full Green Health Day, or maybe even move on to committing to a full 12-week branching out program. And we'll, in Inverness, we would signpost people up to my brain's gone blank. There's branching out programs and trainings run up above Inverness at Abraken, thank you, with Suzanne and her team up there. So up at Abraken. Whereas over sort of Maree way, we'd deliver the branching outs ourselves and encourage people there. But there's a lot of keying in other groups, and Wild Things do some great programs here where we are in Maree, where I am in Maree, and we sort of refer people back and forth between each other. And yeah, does that slightly answer the question?
Yeah, thank you. And Sarah, have you got any experience of using professionals to help people get out there?
Yeah, definitely. I think that both the projects that I mentioned, you know, this relationship building is crucial with the active health link workers. You know, they give, you know, part of their consultation time, they give people a chance to reflect on their personal barriers and look at, you know, what they found difficult in the past, and they help them to talk through that and come up with some solutions. And you know, they often you know, as I say, they tailor their the targets to the person that they're decided together. So they could be quite modest, even just trying to get mobile again within the house if they haven't got confidence at first to go out. So they build it up really gradually. And then with the bespoke project, and that's why they go to the organisations to recruit their participants. So the participants are working with these organisations, or you know, they've got support workers, and they, you know, they help to recruit them to the project, if you like, and they will often come with them on the cycling groups, and you know, they will benefit as well. I mean, that's what they told us, you know, support staff can benefit from it as well, and their relationships away from the cycling groups, you know, the support staff and participant, and you know, that their relationships will benefit from it afterwards as well.
That's a good point. The professionals are benefiting too. Hugh, you've got your hand up.
Yeah, I was just going to ask, I suppose being a professional myself and, you know, been very, you know, always advocating for green health. I mean, looking back on my emails, the first pilot branching out we done was in 2014 in Caithness. And the resistance we got even for colleagues, you know, they'd say things like, oh, is that you going to play in the woods? But the feedback we got for clients, I mean, we had a client who had been involved in mental health services for 20 years, and they said, this is the best intervention I've ever had. So I find with the barriers with the NHS, everything needs researched, everything needs risk assessed. You know, I'm still running groups, and the barriers that have been put in my way have been, you know, very, very difficult and very, very stressful to run programs. But I'll always push through the barriers because, you know, the benefit, you know, you get from, you know, clients, the benefit I get from going and doing stuff, you know, the amount of, you know, quite a stressful job, and you know, so how do we, my question probably is, how do we break the barriers down?
And is it directed at any one of us in particular, Hugh?
Well, just in general, and have you found barriers yourself? Because, you know, as I say, you know, I think the trouble with the health service, again, everyone needs researched, and to me it's a no-brainer. I mean, nature is good for everyone, you know, and it's, I mean, where I'm based in North of Ireland, and all we really have is nature because we've not got much else up here, you know, so that's something we really need to utilise.
I think I'll go. I think I do come across barriers in terms of the formality of process and our expectations on the third sector and their capabilities to fill in things like data sharing agreements and things, their time and the capacity to deliver stuff. And also the funding, which has come up by actually all the speakers today, and the fact that, you know, we're putting patients into these services in the community. We should be doing more to support the communities to enable them to continue the services. And that's been a huge focus of my work since the pandemic, actually. It has been around that sort of community capacity, helping funding applications. So it's, in addition to the funding, it's finding tools and resources to help ease the process. And I think what we need to be doing as a health service is really raising the awareness of this in as many of the sort of senior manager groups across the health service as possible, so that this becomes accepted, and so that we don't get, you know, comments like, are you off to play in the woods again? People see this as a really valuable health service. Dan, you've got your hand up.
Hi, thanks, Ailsa, and hi everybody. So I'm just able to join, so I'm sorry I missed the presentations, but I'm fairly familiar with the work that you lot do. But just on that last point and what you said, Ailsa, just pinged a thing to me. It's at all levels from my perspective, and that bit about kind of NHS leadership supporting all kind of levels of the NHS. There is some very positive noises from more senior leadership throughout the NHS around the place of social prescribing and particularly green health prescribing as part of that health journey. There's a lot of work around what's called realistic medicine, which is a kind of a theme that was a previous CMO's report, and there's some hopefully going to be kind of a webinar seminar for kind of senior NHS managers later this year around more sustainable models of healthcare, more around things like kind of pharmaceutical alternatives, but really kind of highlighting social prescribing, really highlighting green health and nature as a significant and legitimate route of kind of healthcare and supporting people with their health and well-being. So kind of watch this space. I don't want to make any promises from our senior managers, but there's some very positive noises coming from more senior leadership with the NHS about actually putting this properly in the agenda.
Thank you, Dan. And Kirsty, I know you've got to get to another meeting, so do just nip away when you need to. I'll just take one more question from Stephanie now before we go on to our break.
Hi, this isn't really aimed at anyone in particular, but we know that statistically men struggle to verbalise their mental health concerns more than anything. It's kind of a two-pronged question. Do you find that you've had more male engagement because it's more of an activity that they can get involved in and it's not so much just about talking. And when you're running your exercises, do you get, compared to male or women, do you get more women coming along or more males coming along? Just out of curiosity more than anything. For anybody that wants to answer.
Want to pick that one up?
On our branching outs, we tend to have a fairly even split. Some of our groups might be predominantly women, some predominantly men. The nature walks again is a fairly even split as well. But one thing we have done in the past and we aim to do more of is men's groups. We plan to do a bit of men's bushcraft at the end of this year, because I think single sex groups have their place as part of a whole healthy sort of environment. So we might be doing a men's bushcraft weekend, which will give men a space to, I don't know, we find it works quite well. And likewise, we're very keen to organise a women's bushcraft weekend, should if there's interest appeared for that. We have female instructors as well. But in most of our activities, it tends to be, a lot of, especially the ones where people are referred or like branching out, it tends to be seems to be a fairly even split.
Yeah.
Okay, Kirsty's got to nip off now, but very quickly, Kirsty, before you go, are the swimming groups mostly women or mostly men?
A big mix.
Right.
Definitely a big mix, yeah.
Good. Thank you for your contribution today.
No, thank you for having me.
Great. And Hugh, you've got your hand up quickly.
So I was just going to say, most of the groups we run, we try to make things we want it to be all inclusive, so we try not to make it too prescriptive. So we do a lot of kind of craft stuff, so people can get involved in that if they're not as physically able, and then we'll maybe go and do some green woodworking stuff for people who want to do that. So we try to make it a kind of even balance for people, so that they can get involved in something no matter what their abilities are.
Thank you. And Sara, have you got any reflections about the gender divide and the activities you've looked at?
No, it was, again, it's just fairly mixed and depend on which organisations people came from on the bespoke project. But I remember one person saying, one young man anyway, definitely saying that the cycling helped because you weren't forced to talk to someone if you didn't feel like it. So he could cycle on or behind or whatever and felt perfectly comfortable doing that, and it gave him the flexibility to join in with the conversations when he wanted. I mean, I remember that being one of the people are not forced to speak if they don't want to, or interact if they don't want to.
Thank you. Well, I found that very useful. I am going to stop the recording now, because that's the end of the recorded part of the session today.